Well, let's hear from the leadership now of trade union Nehawu. We are joined by Nehawu national spokesperson, Mr. Lwazi Nkolonzi, on the line. And Mr. Nkolonzi, a good morning to you. Thank you so much for joining us. Reports right now of patients being turned away from hospitals, and we're hearing this in various hospitals across the country. Charlotte Maxeke, hospitals in Bloemfontein as well. Pietermaritzburg, patients being turned away at the gate by your striking members. Is this what Nehawu envisioned when you when you embarked on this strike?
Good morning, Naledi, and good morning to the viewers and the listeners at home. Look, Naledi, as Nehawu, when we embarked on a strike, we embarked on a public service strike due to the fact that wage negotiations at the Public Service Coordinating Bargaining Council had collapsed. And we embarked on this strike to raise our dissatisfaction with the government as to how the government has treated workers, undermining collective bargaining, reversing the gains of workers, and also implementing austerity measures, amongst others. So that's why we embarked on this strike, because of those issues. But as Nehawu, we have never embarked on a strike to collapse any institution, health-wise, as we are mentioning. We are not a union that would deliberately go and sabotage the healthcare system. In fact, as Nehawu, we have been a union that has been in the forefront in terms of championing the transformation of our healthcare sector, in terms of transforming it to make it a healthcare sector that is accessible to our people. So we would not do such a thing, as the reports are coming through, saying that we are deliberately sabotaging health.
Mr. Nkolonzi, you are essentially saying that as a union you have championed access to health. But let's be honest, over the past 2 days, yesterday and surely today as well, we have seen reports, videos on social media of your members turning patients away. So what is Nehawu's response right now to reports of patients that are inside hospitals and are not being served, are not being fed at this time? What is Nehawu's response to that particular challenge that we're facing at the moment?
Look, one, as Nehawu, we have made a serious stride to even engage the Department of Health. We, as Nehawu, wrote to the Department of Health to say to the department, health is an essential service, right? Let us put in place mechanisms to meet the essential services level agreement. The department and hospital management did not respond to us. Instead, they were arrogant in their posture responding to us. We wanted to put in place systems that would not collapse the healthcare sector. We said we are willing as Nehawu to venture into that. Let's meet. But what does the department do? They become arrogant. They enforce interdicts on us as if we want to deliberately collapse the system. And our members are expressing their legitimate right to strike. And that's what they're doing.
Right.
And they've not. You see, we must also clarify this thing. We as Nehawu have met our leadership across, and the reports that we have got from our leadership and verified with our leadership do not suggest that we are blockading people from accessing healthcare. We are actually intimidating healthcare personnel. Of course, we cannot be we cannot be ignorant of the fact that there are some opportunists who would want to use our genuine strike.
Okay, let me ask you this about the opportunists then, Mr. Nkolonzi, because you know, we can talk a lot about the process that you are going through with the Department of Health, and I think that's a bigger discussion, certainly one that's gone on for a very long time. The country's watched that conversation. But when you talk about collapsing the health system, we're not just talking about a system here, we're talking about the lives and well-being of citizens. So where you have seen those rogue elements, as you speak of, within the union that are turning away patients and doctors that are wanting to go in and save lives, have you spoken out to those particular members, disciplined them, and even removed them from the gates of healthcare facilities?
One, Nehawu does not have any rogue elements. Our members are demonstrating peacefully. There's no rogue elements within Nehawu. We do not have rogue elements within Nehawu, and we will not agree to that thing to say that Nehawu has got rogue elements. Nehawu does not have any rogue elements. What has been happening is that our members have been demonstrating in their respective workplaces, right? And poorly, the crisis that is confronting health should be placed at the doorstep of government. Government has got blood on its hands in relation to what it has done in health. So we cannot now all of a sudden be told that this is because of Nehawu, when Nehawu has tried by all means to come and find a solution. I said to you, we had proposed to the department, we had proposed to hospital management that we should put in place minimum services in hospitals. They deliberately and arrogantly ignored our pleas as Nehawu. What do you want Nehawu to do? We have communicated with the respective departments and HODs in provinces, but they have been arrogant in their posture. So we cannot now all of a sudden want to be blamed for something that the government itself is liable to. Okay. It's got blood on its hands.
All right. Let me ask you this before I let you go. If someone says to you that, are you essentially saying that the bargaining process is more important than the lives of vulnerable South Africans, 86% of them who do not have access to private healthcare? What do you say to that? And when are you going back then to the bargaining table?
Naledi, we demonstrated that we care about health in this country. We were in the trenches, we were in the front line when everyone else was locked during COVID-19. We risked our lives. Our members lost their lives. Our members were not even remunerated in that process. And when everyone else in society was locked away, our members were working day and night to save the lives of South Africans. And we did that because we knew that as a health union, we are going to be in the forefront of saving lives in South Africa. Now today, why would we as a union that risked its lives, that risked the lives of its members, go and deliberately sabotage our people? We would never do that.
All right. Mr. Lwazi Nkolonzi, thank you for your time. Please let us know when you are back at the bargaining table. We do appreciate your time. Mr. Lwazi Nkolonzi, the national spokesperson for Nehawu.
So we bring in health activist Dr Kgosi Letlape for his comments on the strike. He joins us via Zoom. A very good morning to you, Dr. Letlape. You were listening into that conversation. What are your thoughts about Nehawu's responses?
Good morning to you and the viewers. I think I have sympathy with the responses, but they need to ensure that they take out violence and blockades out of their strike so that people can still have access to care. But the key issue is that the absence of a minimum level service agreement is one of the key drivers of an uncontrolled strike. And we have that because of a dereliction of duty from the state and desperation from the unions. Because that is essential. That's a state duty. If you have a minister in public service and you have leaders of unions and they are not able to conclude that minimum level public service agreement, both of them are not fit to lead. And we should find people that should be able to ensure that that agreement is signed. If we have to go to the courts to mandate that that agreement be signed, we need to do so. Because that's the only way we can protect the vulnerable. We can hold the state responsible for their part in terms of the minimum level service agreement, and the unions in terms of their part. And there should be a commitment that people that need emergency services will not be prevented from receiving emergency services, and we will not put any life in danger.
Yeah.
And we should also ensure that the essential healthcare personnel that are needed to provide those services have safe passage to work and back home.
So what do you think it is that government is sticking to its guns just in terms of the increases that it's given? We heard the Minister of Health earlier on saying that no work, no pay, and those involved in violence, he was threatening there, and also saying that if this continues long enough, he starts to talk about the withdrawal of services.
Well, there's really no ethical basis for application of no work, no pay, when you do not have a minimum level service agreement in play. That is to ensure that the right to strike is exercised, but it is not exercised at the expense of society. And without it, it becomes impossible. So what you see the state doing is that it has never been forced to sign that agreement, and it works in the state's favor for the agreement not to be in place, because they can vilify people for their actions. It makes the unions desperate, and you see the mayhem that we see right now. You see, if you have a minimum level service agreement, it would be difficult to implement no work, no pay, because there would be an agreement of what should happen during the strike. There would be an agreement that there would be sufficient personnel in the hospitals to ensure that lives are not lost, to ensure that those that have chronic diseases do not deteriorate, they have access to their treatments. Now, the state's position is that if they sign it, they think they will be giving a license for the people to strike.
Yep.
What they do not realize is that if they sign it, they will be doing their civic duty to ensure that even if people exercise their right to strike, it is done safely and the interest of the public is put first. One of the other things that I have not mentioned, we spoke about a dereliction from the state, desperation from the unions, but there's indifference from the rest of us who are not impacted by this thing. If I get sick, I've got my medical aid. So those with money or on medical aid are not impacted. And those are the ones making the rules. I mean, I wouldn't be surprised that the leadership of Nehawu is all on medical aid. I know that the ministers are all on PARMED. So we have no skin in the game in terms of the decisions that we are making. We need to tip our heads to the staff and health workers that are manning the fort under difficult circumstances, where they have an infrastructure that is deteriorating because it is not properly funded, or funds are not appropriately used. You know that there's a lot of money in the health system, and if we use it better, we're going to have better outcomes. But we have a procurement system that's a paradise for gangsters. And if we get rid of that procurement system, we'll have enough money to employ human resources, to pay people better without asking for more money from the fiscus. When we can buy skinny jeans with health money, it means the money is there, it's just not being used in appropriate places. We need to devolve power to institutions for them to make decisions to repair minor things that, if not repaired, become in major disasters in terms of the deterioration of our infrastructure. It's time we all had skin in the game. It's time health became a national issue where all of us have a common interest. If the privileged were involved in this, maybe we would be having a minister of human resources in the presidency, because all of us are affected. You know, electricity affects all of us, and there are extreme measures that are being taken to ensure that we have electricity. But in health, the majority of the people are on their own, and we are not really doing enough, because human beings are only driven by self-interest.
And
as long as
Dr.
the interest of
Letlape,
the poor is separate from the privileged, this will be a recurring problem.
And Dr. Letlape, just for effect, I just want to repeat what you said, that we have a procurement system that's a paradise for gangsters. And this is one of the big problems in terms of why public servants, especially, particularly in this case in the health sector, are not being remunerated properly, isn't it?
Yes, that's a key part, because the money is not being spent properly. You also have differentiation. I mean, as far as I know, judges are public servants. As far as I know, MPs are public servants. Have they given themselves 3% as well? Have they given themselves limitations? Or they are public servants of a different kind, that are not there to serve the ordinary, that are there to serve their own pockets and their own lifestyles? So there's enough money. We need to make sure that we revamp the health system to be a common system for all of us. We change the PFMA, we change the way we procure services, we give authority. When we have people that are called managers of facilities, they should be given the authority to be able to fix tabs, buy pens, and do things at a local level. Without, you want to buy a pen for 10 rands, it's 200 rands administration process to buy the pen for 10 rand. That needs to change.
Yeah. But Dr. Letlape, you know, I think it's important to give the South African viewer just perspective in terms of the struggles that doctors and nurses and health service providers in the public sector are dealing with, that justifies this action that they are undertaking at this time.
The action to highlight this and to go on strike is understandable. But the violence and intimidation is not acceptable. The destruction of property, where people have medical aid, they know that they do not need that for their own care, is irresponsible and negligent in the extreme. But what we should not do is to victimize the victim. Let's go to source. The state must take full responsibility of where we are. And even though we should castigate the unions for what is happening at the gates of hospitals, we should ask the state to do their duty to mankind. We should ask this new government not to be the administrators of apartheid in health, and let them stand up for what they went into struggle for: health for all citizens.
Yeah.
So we shouldn't get into this notion where we grandstanding. Health is divided. There's 15% that's in luxury that is not impacted by this. Bring us all together into one system where, as they blockade that place, the president should not have access to services. I should not have access to services. You should not have access to services, so that all of us have skin in the game. As long as we have apartheid in health, this will continue. So we need to ensure that the promises that were made by the liberation movement of one health system for all, where everybody matters, is implemented urgently. Not this business of trying to create a third tier into a two-tiered health system with an NHI.
So at this moment, before I let you go, I want to... Yeah. So at this moment, before I let you go, I just want to treat you like the new electricity minister who has a list of priorities to go through. If you were to tell government now, or perhaps talk to both government and the unions, just in terms of the things that need to be done now to fix the situation, and then we can fix further going forward.
1, a separate negotiating chamber for the health sector, because it is an essential service. We have magistrates that sit elsewhere. They are not in the public service bargaining chamber. So if we have a separate chamber, we are then able to ensure that a minimum level service agreement is agreed upon by all parties. Secondly, scrap apartheid in health. The South African government should have one funding mechanism for health services for all citizens. So instead of coming and creating an NHI, which is like some poor cousin to medical aid, scrap the medical aids as they exist now, reform them to be medical schemes for all citizens, so that they are centrally located, they are an act of parliament that is reformed, they serve all citizens. They don't serve administrators, they serve members. we have a common benefit structure that we could, with time, progressively increase within available resources and looking at the disease burdens that we have. One nation, one health system, from the president to the pauper.
Dr. Kgosi Letlape,
including the Chief Justice of the Constitutional Court and all other privileged South Africans.
Well, Dr. Kgosi Letlape is an ophthalmologist and healthcare leader in South Africa, but he's also a health activist, just giving us his thoughts about that Nehawu strike.